Public health advocates in Nigeria have again stressed on the need for the federal government to ensure effective implementation and taxation on the scale and distribution of sugar-sweetened beverages in the country to a minimum of 20% in its final retail price. At a press conference this Thursday in Abuja, they accused producers of sugar-sweetened beverages in the country of undermining public health for their personal interests. Let's now join Clearview's Gloria Atta for details.
In Nigeria today, there is a high prevalence of non-communicable diseases such as diabetes, cancer, obesity, kidney diseases and other cardiovascular diseases, accounting for about 24% of total deaths recorded every year. Over the years, several studies have linked the intake of excess sugar and sugar-sweetened beverages, which include soft drinks, juices, sweetened coffee, energy drinks and flavored dairy, among leading factors of non-communicable diseases. In a bid to address this issue, stakeholders have converged across different fora and platforms to speak on the health implications of excessive consumption of sugar-sweetened beverages and the need for government to set up policies and regulations aimed at combating the trend. Although the federal government has made efforts to address the worrisome trend by implementing an excise tax of 10 naira per litre on sugar-sweetened beverages, as well as inaugurated different committees aimed at discouraging its excessive consumption, these public health advocates at a press conference say Nigeria is still a far cry from the acceptable global standard.
This is extremely important also because this is the time that the 2023 budget is being debated, as well as the fiscal policy for 2024 budget and the fiscal policy, they are being debated. And the question that always bothers my mind as a Nigerian is, why is it always so easy for government to remove subsidy on products that are, useful for all of us? Electricity, gas. And we have to always continue to mount pressure on government to add taxes for the benefit of public health. Oh, we must supply all the science and all the data and all the economic indices. And the reason is because there are industry behind this, unwholesome lifestyle practices. Do you understand? That want us to continue to consume these products, they continue to make profit, as Dr. said, and continue to compromise our health. And so it is also a time again to reinforce our call on the Nigerian government to increase the taxes on SSB products.
And so we say, recommending to policymakers that they should increase the SSB tax rates, raise the current SSB tax rates to achieve at least 20% increase in the retail prices, aligning with the WHO recommendations. We need to enact a legislative act such that we can ensure the stability and long-term effectiveness of this. We need to allocate the tax revenue wisely, because when the taxes are allocated to healthcare and important social services, again, it helps to address the health and economic bodies.
These are some of the things we've noticed that they've been doing. They go to marketplaces, they do cleanups of community. I mean, if you're talking about cleanups, you're the one producing these products, you're using plastic to do these products. If you don't make the pollution in the first place, there will be nothing to clean. So they go to marketplaces, they go to campuses, they engage youth to participate in their cleanups. They do awards. They go to the beach side to conduct sensitization of how people should take care of their environment by cleaning the products they produce and they allow people to consume. And if you look at the last slide, you see how Guinness are also donating solar-powered motorized water facilities to communities in Oyo State. I mean, these are some of the things they use, and when the community see all these things, they promote their brand and say, okay, this is what the industry are doing for us. And they have little knowledge of the health impact of these drinks that the industry are producing.
They also condemned attempts by beverage companies to sabotage efforts and pro-health initiatives aimed at promoting public health through the use of heavy media campaigns of misinformation. Gloria Atta, reporting for Clearview News.